In this video, I'm going to talk about how I've been preparing for my orthognathic double jaw surgery. So, first of all, what I've been doing physically in order to prepare myself for the surgery. So, I've been working out and doing more cardio than usual. And the reason I've been doing that is to lower my resting heart rate. Now, the reason I want that is because typically when you're working out, when you're recovering, your heart rate is higher. So when I am going through my surgery tomorrow, I just wanted to not put as much strain or just have my heart be as effective as possible. And so that's why I've been doing cardio. And you can see if you work out, you know that after a workout, your resting heart rate is typically a little bit elevated. And then it's fully back down to your normal resting heart rate after a few days of recovery. And so I've been doing that for about 2 months. And this past week, I haven't worked out at all. I haven't worked out at all in order to make sure that my body is fully recovered, fully rested, and have doesn't have any unnecessary inflammation from working out because my body is going to be very inflamed after the surgery tomorrow. Second thing I've been doing is so I asked my doctor what I should be eating or what I should be doing in order to prepare for the surgery. And he pretty much said just eat whatever you want because you won't be able to eat for a whole month after your surgery. You won't be able to eat what you want. It's only going to be liquids and later on like puree until you're fully recovered. But I wanted to be as healthy as possible. So about 2 months ago, I started cutting out sugar. And I started cutting out sugar because sugar is inflammatory. So I was just trying to be as healthy as possible so that I can have the quickest recovery because I'm still in university full time as an engineering student. And fortunately my surgery is like this is spring break right now for us. So the first week after my surgery, I'm actually going to be I won't have any school, so I kind of save that 1 week. I mean, I don't lose that 1 week of classes, but next week classes are back on again from Monday, and so I'll probably skip that 1 week. So it's not as bad as skipping 2 weeks. So I've really reduced down sugar, and I had it completely cut out for a while, but I did have some moments where I moments of weakness where I did have some sugar desserts. And so that's what I've been doing to prepare myself physically. And then we can take a look at what the doctor actually gave me. So he gave me this little bag. We'll take a look at what's inside of it. And there were a few papers inside. So this paper just document called workup. So basically this one just says that it's in French. So but it says use a water pick because they recommend a water pick. I'll show you what that is. Use a water pick starting from the third day at lowest intensity and then gradually increase the intensity. Use the spreading sticks to spread your cheeks more easily. Use the baby toothbrush to brush your teeth. Use a mouthwash after each meal 48 hours after the surgery. It says for patients having ayant eu une chirurgie de la mâchoire du haut, so people having surgery of the top part of your jaw, so like because you can have just the bottom or just the top. So people who also have the top, which I fall into that, I'm getting both top and bottom, a double jaw surgery. It says do not blow your nose for 2 weeks. Use saline water, Salinex. I guess that's a brand. Use saline water. I got some. I'll show you everything. I'm gonna show you everything I got in order to prepare. It says gently clean your nostrils using like a cotton thing, like basically a Q-tip, a wet Q-tip. Then it says ice. So it says you gotta ice consistently for the first 48 hours after the surgery, nonstop. And starting from the third day, you apply heat instead, 10 minutes every hour or as necessary. For food, there's a section on food. It says use the syringe with the spreading sticks for the first 48 hours after the surgery. And after 48 hours, it says it's possible to use a straw or a glass if you can. Liquid diet for the first 2 weeks. And the 2 weeks after that, I believe it's basically puree. And then it says refer to the manual to get some ideas. And so they gave a little manual here. I'll go over it a little bit. And it says medication. The medications to take are the ones prescribed by the doctor at the hospital. So that's that. Then they gave a pamphlet, The Easy and Most Effective Way to Floss, which is basically a pamphlet about advertising the water pick. Double-sided, whatever. They told me I can either get a water pick or just any off-brand one. I'll show you what I got. Then they got this Guide d'alimentation et soins en chirurgie buccale et maxillofaciale. So, nutrition and care guide for mouth and face surgery, something like that. So if we take a look at it, so it says surgery care after the operation, mouth hygiene, medication towards like guérison, so recovery, nutrition, different foods, problems, nutrition stuff. So surgery stuff, it says anesthesia, okay, the use of catheters and blah blah blah. Hospitalization, they say you're gonna spend. They told me I'm gonna spend like 1 to 2 nights at the hospital after the surgery. It says you're gonna have like a lot of numbness and inflammation that increases for the first from 48 to 72 hours and then gradually decreases. It says you get dry lips because you're not able to like moisturize your lips, I guess because your mouth is shut. What else? It says humidified air helps to humidified air helps your breathing, because basically after the surgery, when they're kind of messing around in your sinuses, so your nose can be blocked because of dry blood. And as I mentioned before, it says you're not allowed to blow your nose for the first 2 weeks because of messing around in your sinuses. So it says humidified air helps. You have some stitches, that's it, they go away after a while. It said you can get nausea and vomit. And if that happens, just like, since your mouth is closed, just kind of try to get it out. If it's really bad, then they say you could cut not the stitches, but the elastics they put in order to like open your mouth. But then you have to go back to the hospital, so they shut your mouth again. It says after 24 hours, you can start using a mouthwash, brushing your teeth from the 6th day. So this is just talking about antibiotics and other medications they give you. Physical activity. It says you're basically not going to be fully recovered for up to 2 months. So my doctor told me about no physical activity for about a month. But that doesn't mean like no walking, but no hitting the gym or sports or whatever for at least a month. In this book, it says, it doesn't really specify, but it says you're not going to be fully healed for 2 months. So no like contact sports or anything. It also mentions that they give you like medical days off, or like a doctor's note basically. I think my doctor told me they're going to give me about 4 weeks off. So second section is on nutrition, and basically it says you can either have a liquid diet, puree, and soft food. So like omelets, fish, ground beef. It says it's a good idea to prepare many for you make food and freeze it, and then you can just use it for a few days. So I'll talk about what I've done for that so far. It says you can get some like nutrition stuff like Boost shakes. It says you can also go eat out with your friends, but just bring a thermos with soup in it, so you don't have to put your social life on pause. And so that's pretty much it. I'm not going to go through the whole thing, because then it just talks about like different types of foods you can eat. So I could go into that at some point, but then it also has like a section for recipes. So anyways, that's that. So let's look at what else they gave me in this little bag. So they gave me this little bag. They gave me this little bag that had all those papers in it. And let's take a look at what's in here. So the first thing in here is this syringe. It says it is a 50 ml syringe with catheter tip. So basically, I'm just going to open this up right now just to show you guys. But this is basically how I'm supposed to eat or feed myself. I think this, yeah, so this is like a tip. So let's just, basically I'm supposed to, like, anything I'm going to eat, I have to basically put it in this, and then like my mouth is going to be shut, so I have to just like feed myself like that. That's that. And this is basically supposed to be combined with, as it mentioned on the paper, with, so this is the second thing in the bag. These are wooden spatulas, or the spreading sticks they mentioned. And basically I'm supposed to take these, put them in like the side of my mouth, spread, and then use the syringe to feed myself. Like, that's how I'm supposed to eat for about a month, or maybe like the first 2 weeks, and then I might be able to just drink from a cup or a straw. So that's the first thing. Second thing, the wooden spatulas. This, if you have braces, you probably know what it is. It's just the like wax you can put on your braces on the hooks so it doesn't like cut your gums or whatever. Not your gums, but your cheeks. This thing is tea tree organic lip balm, because it mentioned that your lips can get very, very dry. So that's that. What else? So this is the baby toothbrush to talk about. So this was all given by my surgeon. So they give you a little baby toothbrush because you're going to be too sensitive to actually just properly brush. But apparently you're supposed to be so numb that you don't really feel any pain. But I guess, you know, it's still like a very sensitive area because you're recovering. So I got to use this ultra soft baby toothbrush for the first, I don't know, first week or 2 weeks maybe. I'll ask them tomorrow. Then they also gave me another, like a regular toothbrush, but like ultra soft tip. So the softest tip you can get. I guess that's like when I'm recovered a little bit better. Then the last thing in this bag is this thing right here. You may know what this is if you've had your wisdom teeth removed, and if you're getting this surgery, you probably did have your wisdom teeth removed. So inside of these, there's like two sides to this, inside of which are these gel packs. So this is supposed to be used to ice for the first like 72 hours, 48 or 72 hours. So the way this works is, I'll go ahead and demonstrate. Basically this opens up, or I could probably just put it on like this for now. So you put this on. You have these in the fridge or the freezer, and you basically take these and put them in here so that you can ice your jaw and your cheeks and stuff. It's coming off, but you know, it stays. So that's what you use to ice yourself. So that's what we have here. So that's what the doctor gave me. Now we can take a look at what I've bought in order to prepare. So the first thing we can take a look at is just what I'm gonna eat, or more specifically drink. I have about $140 worth of juices in my room right now. So which is about like 3-4 bags. So in the first bag, I have like a bunch of juices here, which actually my mom got this bag. So this is like mango nectar. So it's not really juice. Fruit punch, not juice. Something that is juice is this, 100% juice. So I got a bunch of these. So inside of this are about 3, 6, 9 cartons of juice right here. I have another bag over here in which I have a total of about 4 of these. 4 V8 low sodium. I have some Great Value apple juice right here, and some Nestea. So that's the second bag. And then the third bag, okay, well, I also have some orange juice. This was probably about like $4 or something. Kind of expensive. And then I have this. I have about 10 cartons in here of different types of Oasis juices. So just like I got like a bunch of different kinds of like different flavors because I thought I'd probably get bored of drinking juice all day. So I got some basic apple stuff, some punch, ruby red grapefruit. I also got some Arizona iced tea because I do drink a lot of coffee and I thought this would probably be a good way to get some caffeine in. Other than coffee. Then I also got this thing. So I got 2 of these, 10 vegetable cocktail. I think my favorite one is probably like peach clementine and mango, exotic mango. These are probably the ones because I've tasted these before and I really like them. So that is the third bag. So that's about like, in Canadian dollars, is about $140 worth of juice. But realistically, if we just take a look at one of these, assuming I need about, sorry, I'm just going to drink some water. So assuming I need about 2,000 calories, maybe a little less because I won't really be doing much, just laying in bed for a while. This says it's 110 calories for 1 cup, which means that this whole thing, it's less than a liter, but this whole thing has about 400 calories. And so if I need 2,000 calories, I need to drink like 5 of these, 4 to 5. Now, obviously, this won't be the only thing I'm drinking, but that's why I have like a bunch of juices. So, second thing, the next thing I have is, I just got these today, Premier Protein. So this has 18 units, 18 packs of protein shakes. So this has about 30 grams of protein and a bunch of other stuff. So vitamins and stuff. I don't know if you can see this, but probably can't. So it has a bunch of vitamins and stuff. So if I can manage to drink like 1 or 2 of these, that should be pretty good in terms of getting my protein in. That would be 60 grams of protein right there. Should be good. And so this is the vanilla flavor, and I also got the chocolate version. So 18 plus 18, 36. That should last me a while. Another thing I got is, I actually didn't buy this. It was my brother's, so I took it from him. But I got this Vicks air purifier or humidifier, whatever. So this, you basically just fill it up with water. You open it up, you fill it up with water. You turn it on once it's plugged in, and it just kind of sprays water vapor. And there's also this section on it where you can put in a Vicks like pack. So spray some Vicks in the air. So got this because it mentions that, or like I'm gonna use this. I use this a lot in winter, but I'm gonna use this now especially in order to keep the air humid because that's supposed to help me breathe. Speaking of breathing, I got these Breathe Right nasal strips. These are pretty good. I've used these in the past just like that when I've had trouble breathing. If my nose was congested or something, and these are pretty good. They really they instantly open up your nasal airways. So I got these. This was about $22 or $23 for 30 strips. I got this saline nasal solution. I've never used this one specifically. I have usually used Hydrosense in the past whenever I've needed it. But I got this just in case, it was well priced, and all it really has is water and saline water. So it's a mix of 60% seawater. Yeah, that's what it's called. So 60% seawater and 40%, I guess, purified water. So I got that. That should help me clean my nostrils after the surgery. Now the next thing I have is they talked about the water pick, so let's start with that. So I got the water pick right here. This is my brother's, but I'm going to be using it, or I'm going to test it out, because what I actually have is this thing, H2O floss, which is the same exact thing. Like, it just shoots water. In this one, you fill water in the bottom. It's just one device. I'll take it out and show you. It fulfills the same purpose. So this is something I bought off Amazon pretty cheap. And that is like, I don't know, like $100. So all this is you fill water at the bottom, you turn it on, you select the intensity, and then it has like a few things in here. All you do is you attach one of the heads at the top and you clean your teeth with it. So I bought this, and then I found out that my brother had an actual water pick. And so I'll probably compare these two and see which one is actually worth it. So I'll be using this. The doctors recommend it for after the surgery for cleaning your teeth. And I think that's about everything I have here so far. The next thing I can talk about is just the stay at the hospital. So I'm supposed to stay 1 to 2 nights at the hospital. So to not keep myself bored, if I'm going to be awake there for a while, I'm going to be bringing my Kindle to read. I'm going to be bringing probably like another tablet with like some Netflix on it so I can watch some stuff. And I'll bring my laptop. Other than that, I actually haven't packed for my stay at the hospital. So I'm going to go ahead and do that now. Next thing I have to do actually is, if you're a guy and you should probably know this, but you're supposed to shave, and that's kind of a big thing for me because I've always had a beard, and this is actually the shortest my beard has ever been because I've always had a beard. And the only reason it's this short is because the way I've been mentally preparing myself to shave my beard is slowly reducing it. It may sound dumb, but if you're a guy who's had a beard or who's had a beard for a long time, it's pretty weird. You kind of become attached to your beard and it kind of becomes a part of you. So having to shave it is a big deal. So I'm going to go ahead and do that after this video. But so for the past 2 months, I've been slowly reducing how short my beard is. And this is the shortest. And then tonight, I'm going to go ahead and shave my beard. I have to do that so that they have, better access or whatever to do the surgery. So I guess that is something you should know if you have to consider that, if you're a guy, that you will have to shave your beard. So next steps, what I'm going to do is I'm going to pack up for my stay there, bring whatever I may need. I'm going to go ahead and shave my beard, take some pictures, take some before pictures. That's very important. Remember to do that. Obviously your surgeon has some, but it's a good idea to take your own. You guys have this video of me. I have this video as well. And so we can take a look at it again. So my face right now is, the bottom jaw is deviated to the left. That's the left side. It should be like this. So this is the center, but the bottom of my chin is kind of all the way over here, right? But it should be like here. So you probably don't notice it if you don't pay attention, but if I tilt my head down, you can see it. Anyways, I'm a little bit nervous. I hadn't thought about it at all I didn't want to psych myself up, but I'm getting a little bit nervous, but it's also kind of exciting to know that I'm going through my surgery tomorrow and I can't wait to see the results. So with that, take care, guys. Hit the like button if you like this video and you want to see more progress as I go through orthognathic jaw surgery. And make sure to hit the subscribe button so that you get notified when I post a new video. Take care.